The Systemization Jump-Starts. So we talked about what a big, huge, daunting task the systemization stuff is in your practice, and I get it, which is why we created this template, which is going to get people to look at things and say, oh shoot, I have 6 things exactly missing from this template. I need to work on this one next, and this one next. Once I finish that, type it up with our help, then they upload it into the operations manual template, and that portion is done. For people that just have this overwhelm when it comes to even thinking about putting an operations manual together, I have the Systemization Jump-Start. These are the 3 systems that I think that anybody can go back. Remember, we're talking about Monday morning dentistry. You can go back to your practice and implement them first thing Monday morning, and the entire 16 hours, going on 17 hours now that you've spent in this room with us, will be worth it if you do the Systemization Jump-Start and you're not currently doing it. Okay, you ready? Guys, try to contain your excitement. All right, thank you. End of day protocol. Who's doing an end of day protocol? Downtime protocol. Who's doing a downtime protocol? Office manager AM protocol. Who's doing that? You guys listen to the podcast, don't you? All right. End of day protocol. Whatever is driving you crazy in your practice. Whatever things you tell your team members to do before they leave that aren't getting done, end up on the end of day protocol. If you could list 7 things per position that absolutely have to get done, just eliminate all the protocols, all the checklists, all the everything, 7 things that absolutely have to happen before you leave this office. If you could boil it down to that, put it on the end of day protocol. They check it off and they put it in. They literally check it off and they put it in the bin of the office manager, okay? They put it in the office manager's end of day protocol bin, all right? So they're accountable for the things that they check off. They can't leave out the door until they check it off and sign it and put it in the office manager's end of day protocol box, okay? So whatever things are driving you the most crazy that are consistently not getting done, right? If people aren't doing the trash, if they're not boxing up the lab cases at the end of the day, if their charts are consistently not getting done, put those on the end of day protocol. It will fix it, okay? Here's the hygienist, post-op calls, route slip notes are accounted for, and all chart notes are done. Notice these are dry erase, like we laminate it and they dry erase it, so we use them over and over again. Restock rooms, all instruments sterilized, check production report to ensure your production is accurate. Today's production was versus the goal. Sign finalized production report and give to office manager. End of day form is signed and given to office manager. Signed, signature, placed in the box. Stuff gets done now. That's just a little tiny bit of accountability. It's a good way to dip your toe into the systemization without saying, hey guys, good news. We're going to do an operations manual. It's 62 pages. Let's start with page 1. Go. So this is one of the most important protocols because it's quite easy to do. You can implement it right away, and stuff gets done. They start to feel what a systemized office should feel like. Okay? This is the AM office manager protocol. So the office manager is going to get a stack of end-of-day protocols. She's going to get to the office before anybody else, and she's going to walk the office. If one of the end-of-day protocols for Susie was that she has to restock all of the rooms, and maybe she's in charge of the bathroom that week, then she goes and she looks in the drawers of all of Susie's rooms, and then she looks in the bathroom. Susie's good. And then she walks, and then she looks at the reception area. Does the reception area look like the picture in the operations manual? Good, thumbs up. How about the break room? How about the hallways? All of that stuff she does a morning walkthrough. Facility's okay. Then she's going to look at charts. She's going to audit charts, just randomly audit charts, make sure that everybody did that. She's going to make sure that she looks at the place where we put the lab cases for the UPS driver. She's going to make sure those are all done. She's going to walk the facility. She's going to get ready for her morning huddle. That's the office manager AM protocol. Okay? With the office manager AM protocol, if you set it up the right way, you will start the day the right way. There won't be chaos. You know that everything was done from the previous day. And if it wasn't, then we bring it up in the morning huddle. We want that morning huddle to be less than 10 minutes. So if people are consistently not doing what they say they did, on the checklist, then we have a problem. Okay? All right. Operations manual creation, we talked about this already. Are there formal written policies for clinical efficiencies and accountability, sterilization, billing and insurance issues, front and back office protocol, patient flow and experience, hygiene department protocol, common area protocol, beginning and end of day protocol, downtime protocol, we just talked about this, AM office manager protocol. Okay, the one that I forgot was downtime protocol. So downtime protocol is basically what happens if the schedule completely falls apart, which in startup practices and some seasoned practices, it happens from time to time. You only need your curettes to be so dang sharp, right? If the hygiene department is sharpening curettes every time somebody cancels an appointment, you don't need 3 hours of curette sharpening, right? What would be maybe more productive if they got on the phone and started working that recall list or the unscheduled treatment list. If you have those ready to go and that's on the downtime protocol list, then it would go straight to that. As soon as the schedule falls apart, the downtime protocol is triggered and everybody knows exactly what to do. Most times it's picking up the phone and calling because that is how you turn non-producers into producers, by actually getting people reactivated, getting people back in for recall, getting people back in for treatment plans that haven't been started yet. Okay? Are these documents assembled in one organized, easy, accessible operations manual? All right, those are the questions that you're going to want to ask yourself. Just those 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 questions. If you can answer those questions and to the affirmative, then you have an operations manual. Okay? Let me tell you this about operations manuals as well. We're talking about a lot about just getting it done, putting it together, and having it as a working, living, fluid document that changes as it needs to be changed. I will tell you this, one of the most important things about creating an operations manual is that you want to make sure that there's authorship from your team. If you and your regional manager and your office managers sit down one weekend with a 12-pack of beer and a pizza and knock it out over 18 hours, and you're proud of it, and you put it in a binder, everything's laminated, you're ready to go, you have that meeting on Monday morning, and people will look at you like you just grew an arm out of the top of your head. It will never get implemented. The stuff will never get implemented. They have no ownership over it. You have to give your team authorship over all of the systems in the operations manual, okay? If they don't have authorship over it, it will never get used. It will be a very expensive document as far as time and energy that sits on your shelf collecting dust. If they have authorship, they will use it.